Question 1. Comparative studies suggest that virtual selling techniques can be highly effective for medical sales representatives, but their success hinges on strategic implementation. Considering the regulatory framework for medical device promotion, which of the following approaches best aligns with best professional practice for engaging healthcare professionals virtually? Option A. Focusing on interactive elements such as live polling, screen sharing of relevant clinical data, and asking targeted questions to gauge understanding and tailor the discussion to the healthcare professional's specific clinical needs and practice. Option B. Sharing detailed technical specifications and clinical trial results without explicitly asking for the healthcare professional's input, allowing them to absorb the information at their own pace. Option C. Briefly mentioning the product's primary indication, and then transitioning to a discussion about potential future product enhancements and research, without confirming current product understanding. Option D. Conducting a high-level overview of the product's features and benefits, assuming the healthcare professional has a general understanding of the therapeutic area, and concluding the session promptly to respect their time. The correct answer is D. Conducting a high-level overview of the product's features and benefits, assuming the healthcare professional has a general understanding of the therapeutic area, and concluding the session promptly to respect their time. Explanation. This scenario presents a professional challenge because medical sales representatives must adapt their established in-person selling techniques to a virtual environment while adhering to strict regulatory guidelines. The challenge lies in maintaining engagement, conveying complex product information effectively, and building rapport without the benefit of physical presence, all while ensuring compliance with regulations governing medical device promotion and data privacy. Careful judgment is required to balance the need for persuasive selling with ethical conduct and legal requirements. The correct approach represents best professional practice because it prioritizes a structured, compliant, and patient-centric virtual engagement. This involves preparing thoroughly, tailoring the presentation to the specific needs of the healthcare professional, HCP, utilizing interactive tools to enhance understanding, and diligently adhering to all promotional regulations. This method ensures that the representative provides valuable information in a compliant manner, fostering trust and a positive professional relationship. It aligns with the ethical imperative to educate HCPs accurately and responsibly, ultimately benefiting patient care. An incorrect approach that focuses solely on product features without understanding the HCP's specific needs or clinical context fails to provide relevant value and may be perceived as a generic sales pitch, undermining the representative's credibility. This approach risks violating regulations that require promotional materials to be balanced and not misleading, as it may overemphasize benefits without adequately addressing potential risks or limitations in a way relevant to the HCP's practice. Another incorrect approach that neglects to confirm the HCP's understanding or solicit feedback during the virtual interaction can lead to miscommunication and a lack of comprehension regarding the product's use or benefits. This can result in noncompliance with regulations that mandate clear and accurate communication, potentially leading to improper product use or prescribing decisions. It also fails to build rapport, a crucial element of professional relationships. A further incorrect approach that involves sharing sensitive patient information or discussing off-label uses of a product during a virtual interaction is a direct violation of privacy laws and promotional regulations. This demonstrates a severe lack of ethical judgment and regulatory awareness, posing significant legal and reputational risks to both the representative and their company. The professional decision-making process for similar situations should involve a thorough understanding of the regulatory framework governing medical device promotion and virtual interactions. Representatives should always prioritize the HCP's needs and clinical context, tailor their communication accordingly, and employ interactive techniques to ensure comprehension. Continuous learning about best practices in virtual selling, coupled with a commitment to ethical conduct and regulatory compliance, is essential for navigating these challenges effectively. Question 2. The risk matrix shows a moderate likelihood of increased scrutiny on pharmaceutical marketing practices due to evolving healthcare reimbursement models and a high impact on physician prescribing habits. Which approach best demonstrates a CMSR understanding of the healthcare industry in this context? Option A. Prioritizing the achievement of sales targets by highlighting the product's cost-effectiveness, without a thorough understanding of the specific reimbursement challenges faced by individual practices. Option B. Focusing discussions with healthcare providers primarily on the clinical efficacy and patient benefits of the product, while proactively seeking to understand how the product aligns with current and anticipated reimbursement landscapes and value-based care initiatives. Option C. Limiting interactions to providing basic product information and avoiding discussions about broader industry trends or economic factors to prevent potential compliance issues. Option D. Emphasizing the product's unique selling propositions and competitive advantages, assuming that healthcare providers will independently assess its fit within their practice and financial constraints. The correct answer is B. Focusing discussions with healthcare providers primarily on the clinical efficacy and patient benefits of the product, while proactively seeking to understand how the product aligns with current and anticipated reimbursement landscapes and value-based care initiatives. Explanation: this scenario is professionally challenging because it requires a medical sales representative to navigate the complex interplay between understanding the broader healthcare industry landscape and adhering to strict regulatory guidelines governing interactions with healthcare professionals. The representative must demonstrate a sophisticated awareness of how economic pressures, technological advancements, and evolving patient care models impact prescribing decisions and product adoption, while simultaneously ensuring all promotional activities are compliant and ethical. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the healthcare ecosystem, enabling the representative to engage in value-added discussions that align with the strategic objectives of healthcare providers and institutions. This approach fosters trust and positions the representative as a knowledgeable partner rather than solely a product vendor. It demonstrates an understanding of the Certified Medical Sales Representative (CMSR) role as one that requires strategic insight into market dynamics, patient outcomes, and healthcare economics, all within the bounds of regulatory compliance. This proactive and informed engagement is crucial for building long-term relationships and achieving sustainable success in the medical sales field, aligning with the ethical principles of providing accurate and relevant information. An incorrect approach that focuses solely on product features without considering the broader healthcare context fails to acknowledge the economic and clinical realities faced by healthcare professionals. This can lead to misaligned messaging and a perception of the representative as out of touch with the needs of the market. From a regulatory and ethical standpoint, this approach risks violating guidelines that emphasize providing information relevant to patient care and economic value, potentially leading to misrepresentation or an undue focus on sales targets over patient well-being. Another incorrect approach that prioritizes immediate sales gains over understanding the industry's strategic direction is also professionally unsound. This can result in short-sighted tactics that may alienate healthcare providers and damage the company's reputation. Ethically, it can lead to pressure tactics or the provision of incomplete information, which can be detrimental to patient care and violate principles of professional conduct. A further incorrect approach that neglects the impact of emerging healthcare trends on product adoption overlooks critical market shifts. This can lead to the representative being unprepared to address evolving clinical pathways or reimbursement challenges, making their product offerings seem less relevant. Regulatory and ethical failures here could include failing to provide accurate information about how a product fits into new treatment paradigms or ignoring evidence of changing market demands, which could be seen as a form of professional negligence. The professional decision-making process for similar situations should involve a continuous learning mindset regarding the healthcare industry, including economic factors, technological advancements, and policy changes. Representatives should actively seek to understand the strategic priorities of their clients and how their products can contribute to achieving those goals. This requires a balanced approach that integrates market intelligence with a deep understanding of regulatory requirements and ethical obligations, ensuring that all interactions are both compliant and strategically beneficial. Question 3. To address the challenge of promoting a new medical device while strictly adhering to the regulatory framework for medical sales representatives, what is the most appropriate course of action when developing promotional materials? Option A. Provide significant financial incentives or gifts to healthcare providers who demonstrate high prescription rates of the device to foster stronger relationships and encourage continued use. Option B. Ensure all promotional materials undergo a thorough review and approval process by the company's internal regulatory and legal departments, verifying that all claims are substantiated by evidence and present a fair balance of benefits and risks. Option C. Focus marketing messages primarily on the device's benefits and unique selling propositions, with only a brief mention of potential risks or side effects to maintain a positive impression. Option D. Disseminate preliminary clinical study results to key opinion leaders and healthcare professionals to generate early interest and gather feedback, even if the data has not yet been fully analyzed or published. The correct answer is B. Ensure all promotional materials undergo a thorough review and approval process by the company's internal regulatory and legal departments, verifying that all claims are substantiated by evidence and present a fair balance of benefits and risks. Explanation. This scenario presents a professional challenge due to the inherent tension between promoting a medical device and adhering to strict regulatory guidelines designed to protect patient safety and ensure fair market practices. The challenge lies in navigating the complex landscape of promotional activities, ensuring that all communications are accurate, balanced, and do not mislead healthcare professionals or patients. Careful judgment is required to interpret and apply the relevant regulations to specific promotional contexts. The correct approach represents best professional practice because it prioritizes compliance with the regulatory framework governing medical device promotion. Specifically, it ensures that all promotional materials are reviewed and approved by the appropriate internal regulatory and legal departments before dissemination. This process guarantees that claims made about the device are substantiated by clinical evidence, are not exaggerated, and present a fair balance of benefits and risks, aligning with the principles of responsible marketing and patient welfare as mandated by the relevant regulatory bodies. An incorrect approach that involves sharing preliminary or unverified clinical data with healthcare professionals before it has undergone rigorous review and regulatory approval is a significant ethical and regulatory failure. This action can lead to the dissemination of inaccurate or misleading information, potentially influencing clinical decisions based on incomplete evidence, which undermines patient safety and violates regulations against unsubstantiated claims. Another incorrect approach, such as offering incentives or gifts to healthcare professionals in exchange for prescribing or recommending the device, constitutes a violation of anti-kickback statutes and ethical guidelines. Such practices can compromise professional judgment and create an unfair competitive advantage, eroding trust in the medical profession and the pharmaceutical industry. A third incorrect approach, which involves downplaying or omitting potential risks or side effects of the medical device in promotional materials, is a direct contravention of regulatory requirements for fair balance. This omission can lead healthcare professionals to make treatment decisions without a complete understanding of the device's safety profile, posing a risk to patients. The professional decision-making process for similar situations should involve a thorough understanding of the applicable regulatory framework, including guidelines on advertising, promotion, and interactions with healthcare professionals. Before engaging in any promotional activity, a medical sales representative should consult with their company's regulatory affairs and legal departments to ensure all communications and actions are compliant. A proactive approach to seeking guidance and adhering to established internal review processes is crucial for maintaining ethical standards and regulatory compliance. Question 4. Process analysis reveals that a medical sales representative is promoting a novel diagnostic imaging device to cardiologists. The device has received regulatory clearance for detecting certain types of arterial blockages. During a sales presentation, a cardiologist inquires if the device can also be used to monitor the effectiveness of a new stent placement procedure in real time, a use not explicitly listed in the device's approved indications. What is the most appropriate and compliant course of action for the medical sales representative? Option A. Advise the cardiologist to consult the device's technical manual for information on potential off-label uses and encourage them to trial the device for this purpose. Option B. State that as long as the device is technically capable of performing the function, it is acceptable to discuss its potential for new applications with healthcare professionals. Option C. Enthusiastically agree that the device would be excellent for monitoring stent placement, highlighting its advanced imaging capabilities, and suggest they explore this application further. Option D. Inform the cardiologist that while the device is cleared for detecting arterial blockages, its use for monitoring stent placement effectiveness is not an approved indication and therefore cannot be promoted or discussed as such. The correct answer is D. Inform the cardiologist that while the device is cleared for detecting arterial blockages, its use for monitoring stent placement effectiveness is not an approved indication and therefore cannot be promoted or discussed as such. Explanation: this scenario is professionally challenging because it requires a medical sales representative (MSR) to navigate the complex classification of medical devices and understand their intended uses within the regulatory framework of the Certified Medical Sales Representative (CMSR) exam-specified jurisdiction. Misclassifying a device or promoting it for an unapproved use can lead to significant regulatory violations, patient harm, and damage to the company's reputation. Careful judgment is required to ensure all promotional activities align strictly with the device's classification and approved indications. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance by accurately identifying the device's classification, e.g., Class I, Roman II, or Roman III in the U.S. framework, or equivalent in other specified jurisdictions, and understanding its approved indications for use. The MSR ensures that their promotional activities are lawful and ethical. This involves consulting official documentation, such as the manufacturer's labeling and regulatory clearance documents, and refraining from making claims that extend beyond these approved uses. This adherence to regulatory guidelines is paramount for maintaining trust with healthcare professionals and ensuring responsible product promotion. An incorrect approach involving promoting a device for an unapproved use constitutes a regulatory failure. This is often referred to as off-label promotion and is strictly prohibited. It can lead to severe penalties, including fines, product recalls, and legal action against the company and the individual MSR. Ethically, it is unacceptable because it exposes patients to potential risks without the benefit of established clinical evidence and regulatory oversight for that specific use. Another incorrect approach, such as assuming a device's classification without verifying it, is a failure in due diligence. This can lead to miscommunication with healthcare providers about the device's capabilities and limitations, potentially resulting in improper use and patient harm. It also bypasses the established regulatory pathways designed to ensure device safety and efficacy. A third incorrect approach, focusing solely on sales targets without considering the regulatory implications of device promotion, demonstrates a disregard for professional responsibility. While sales are important, they must always be achieved within the bounds of the law and ethical conduct. Prioritizing sales over compliance creates a high-risk environment for both the MSR and their employer. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the specific medical device in question. 2. Determine its regulatory classification according to the governing body for the specified jurisdiction. 3. Thoroughly review the device's approved indications for use as stated in its labeling and regulatory clearance. 4. Consult internal company resources and regulatory affairs departments for clarification if needed. 5. Ensure all promotional materials and discussions accurately reflect the device's classification and approved uses. 6. Refrain from making any claims or suggestions that imply the device is suitable for uses not explicitly cleared or approved. 7. Prioritize patient safety and regulatory compliance above all other considerations. Question 5. Operational review demonstrates that a key physician client has expressed significant interest in a new therapeutic area your company is entering, but has also mentioned recent financial pressures on their practice. The physician has also inquired about your company's sponsorship opportunities for upcoming medical conferences. How should a certified medical sales representative, CMSR, navigate this situation to maintain a compliant and effective client relationship? Option A. Suggest that the physician's practice could benefit from a direct financial grant from your company to offset their recent financial pressures, contingent on their adoption of your company's new products. Option B. Offer to cover the physician's registration fees and travel expenses for a relevant medical conference, emphasizing the educational value and networking opportunities. Option C. Focus on providing comprehensive educational materials about the new therapeutic area, including clinical trial data and peer-reviewed publications, and offer to arrange a presentation by a medical affairs specialist. Option D. Discuss potential speaking engagements for the physician at industry-sponsored events, highlighting the honorarium they would receive, which could help alleviate their financial concerns. Correct answer is B. Offer to cover the physician's registration fees and travel expenses for a relevant medical conference, emphasizing the educational value and networking opportunities. Explanation. This scenario presents a common challenge in medical sales, balancing the need to build strong client relationships with the imperative to adhere to strict regulatory guidelines. The professional challenge lies in ensuring that relationship-building activities do not inadvertently cross the line into inducements or create conflicts of interest, which could violate regulations designed to ensure fair competition and patient safety. Careful judgment is required to distinguish between legitimate professional engagement and activities that could be perceived as inappropriate influence. The correct approach prioritizes transparency, adherence to company policy, and a focus on providing value through education and support, rather than material benefits. This aligns with the ethical principles of promoting responsible prescribing and ensuring that healthcare professionals make decisions based on clinical merit and patient needs, not personal gain. By focusing on educational resources and clinical support, the medical sales representative upholds the integrity of the physician-patient relationship and maintains compliance with relevant regulations. An incorrect approach that involves offering gifts or entertainment beyond nominal value, or providing financial incentives, directly violates regulations prohibiting inducements. Such actions can create a perception of bias, compromise the objectivity of healthcare professionals' prescribing decisions, and undermine public trust in the pharmaceutical industry. These practices are often explicitly prohibited by industry codes of conduct and government regulations, aimed at preventing kickbacks and undue influence. Another incorrect approach, such as sharing proprietary or non-public information about competitor products, is unethical and potentially illegal. This undermines fair competition and can lead to misinformed decisions by healthcare professionals. It also violates principles of professional conduct and can damage the reputation of both the representative and their company. The professional decision-making process for similar situations should involve a clear understanding of the company's compliance policies and relevant regulations. Representatives should always ask themselves if their proposed action could be perceived as an inducement or create a conflict of interest. Prioritizing educational value, clinical support, and transparent communication, while strictly adhering to established guidelines, is paramount. When in doubt, seeking guidance from the compliance department is the most responsible course of action. Question 6. The performance metrics show a significant dip in sales for a new line of advanced laparoscopic surgical instruments. To boost these numbers, you are considering highlighting only the innovative features and potential for improved surgical outcomes, while subtly omitting any mention of the instrument's steeper learning curve or the need for specialized post-operative care protocols that are not yet widely adopted by your target hospitals. You also have the option to offer a bundled discount if a hospital commits to purchasing a minimum quantity of this new instrument line within the next quarter. Alternatively, you could focus on a comprehensive, data-driven presentation of the instrument's efficacy and safety profile, including all documented limitations and the necessary training requirements for optimal use, even if this means a slower initial sales cycle. Which approach best aligns with regulatory compliance and professional ethics for a certified medical sales representative? Option A. Highlight only the innovative features and potential for improved surgical outcomes, while subtly omitting any mention of the instrument's steeper learning curve or the need for specialized post-operative care protocols. Option B. Focus on a comprehensive, data-driven presentation of the instrument's efficacy and safety profile, including all documented limitations and the necessary training requirements for optimal use, even if this means a slower initial sales cycle. Option C. Offer a bundled discount if a hospital commits to purchasing a minimum quantity of this new instrument line within the next quarter, emphasizing the cost savings. Option D. Emphasize the instrument's potential for improved surgical outcomes and offer a bundled discount, while downplaying the learning curve and post-operative care needs. The correct answer is B. Focus on a comprehensive, data-driven presentation of the instrument's efficacy and safety profile, including all documented limitations and the necessary training requirements for optimal use, even if this means a slower initial sales cycle. Explanation: scenario analysis. This scenario is professionally challenging because it requires a medical sales representative to balance the drive for sales performance with strict adherence to regulatory guidelines regarding the promotion and demonstration of medical devices. The representative must ensure that any information provided about surgical instruments is accurate, not misleading, and complies with the specific regulations governing medical device sales and marketing within the designated jurisdiction. The pressure to meet performance metrics can create a temptation to overstate benefits or downplay limitations, which is a direct contravention of ethical and regulatory standards. Correct approach analysis. The correct approach involves prioritizing accurate and compliant communication about the surgical instruments. This means providing factual information about the instrument's intended use, specifications, and any documented clinical evidence, while also clearly stating any limitations or contraindications. This aligns with the fundamental principles of responsible medical device promotion, ensuring healthcare professionals have the necessary information to make informed decisions for patient care. Regulatory frameworks for medical device sales typically mandate truthful and non-misleading representations, and this approach upholds those requirements by focusing on objective data and avoiding unsubstantiated claims. Incorrect approach is analysis. One incorrect approach involves emphasizing only the most advanced features and potential benefits of the surgical instruments, while omitting or downplaying any known limitations or potential risks. This is a regulatory failure because it constitutes misleading promotion, violating guidelines that require a balanced and truthful representation of a medical device. It can lead healthcare professionals to make purchasing decisions based on incomplete or biased information, potentially impacting patient safety and outcomes. Another incorrect approach is to offer incentives or discounts that are contingent upon the purchase of a specific surgical instrument, without ensuring that these incentives are compliant with all applicable anti-kickback statutes and regulations. Such practices can be construed as inducements to purchase, rather than decisions based on the merits of the instrument itself, and are often strictly prohibited to maintain the integrity of healthcare purchasing decisions. A third incorrect approach is to provide hands-on demonstrations of surgical instruments to healthcare professionals without ensuring that the demonstration is conducted in a controlled environment and that all participants are aware of the experimental or non-approved nature of certain functionalities, if applicable. This can lead to misinterpretations of the instrument's capabilities or risks and may violate regulations concerning the promotion of devices for unapproved uses or in a manner that could be perceived as providing unauthorized medical advice or training. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough understanding of the relevant regulatory landscape for medical device sales and promotion. This includes familiarizing oneself with guidelines on advertising, marketing, and interactions with healthcare professionals. When faced with performance pressures, the representative should always default to a principle of transparency and accuracy. This involves a critical self-assessment of any proposed communication or demonstration. Is this statement factually accurate? Is it misleading in any way? Does it comply with all applicable regulations? Would this information enable a healthcare professional to make a fully informed decision? If any doubt exists, seeking clarification from regulatory affairs or legal counsel is paramount. The ultimate goal is to build trust through integrity and compliance, rather than short-term sales gains achieved through questionable practices. Question 7. Consider a scenario where a medical device company is launching a new diagnostic tool that utilizes artificial intelligence, AI, for preliminary analysis of patient data. As a certified medical sales representative, CMSR, you are excited about the potential of this AI feature to streamline physician workflow and improve diagnostic accuracy. You have received preliminary information from the AI developer suggesting advanced predictive capabilities beyond the device's currently approved indications. Which approach best aligns with regulatory compliance and ethical professional practice for a CMSR? Option A. Rely solely on the AI developer's assurances that the advanced features are compliant and begin incorporating them into your sales pitches immediately to gain a competitive edge. Option B. Proactively present the AI's advanced predictive capabilities to healthcare professionals, emphasizing its potential to identify conditions not yet officially indicated for the device, while assuring them that regulatory approval is anticipated. Option C. Focus all promotional discussions on the AI's role in supporting the device's approved indications, and collaborate with the company's regulatory and legal teams to develop compliant marketing materials and training for the advanced features once they receive full approval. Option D. Utilize the AI's advanced predictive capabilities in your sales presentations by demonstrating its potential through anonymized case studies, without explicitly stating it is for off-label use, to gauge physician interest. The correct answer is B. Proactively present the AI's advanced predictive capabilities to healthcare professionals, emphasizing its potential to identify conditions not yet officially indicated for the device, while assuring them that regulatory approval is anticipated. Explanation: this scenario presents a professional challenge due to the rapid evolution of medical sales technologies and the inherent need to balance innovation with established regulatory compliance and ethical conduct. The Certified Medical Sales Representative, CMSR, must navigate the introduction of a new technology that promises enhanced patient outcomes and improved physician engagement, while simultaneously ensuring all promotional activities adhere strictly to the regulatory framework governing medical device sales within the specified jurisdiction. The core challenge lies in discerning how to effectively leverage emerging technologies for sales and marketing without crossing lines into misrepresentation, off-label promotion, or data privacy violations. Careful judgment is required to ensure that the pursuit of competitive advantage through technology does not compromise patient safety, physician autonomy, or the integrity of the sales process. The correct approach represents best professional practice because it prioritizes a thorough understanding and adherence to all applicable regulations and ethical guidelines before and during the implementation of new technologies. This involves proactive engagement with legal and compliance departments, ensuring all marketing materials and sales strategies are vetted, and that the technology is used in a manner that supports factual, evidence-based communication about the medical device. This approach safeguards the company, the healthcare professionals, and ultimately the patients, by ensuring that technological advancements are integrated responsibly and ethically into the sales process, aligning with the core principles of the CMSR certification. An incorrect approach that involves directly promoting the new technology's capabilities to healthcare professionals without prior regulatory review and approval is professionally unacceptable. This constitutes a significant regulatory failure, as it risks violating prohibitions against off-label promotion, which can lead to severe penalties for both the representative and the company. Ethically, it undermines the trust between the sales representative and the physician by potentially presenting unproven or unapproved benefits, thereby compromising informed decision-making. Another incorrect approach, which is to solely rely on the technology provider's assurances regarding compliance without independent verification, is also professionally unsound. This demonstrates a lack of due diligence and can lead to unintentional regulatory breaches if the provider's claims are inaccurate or incomplete. It fails to uphold the CMSR responsibility to ensure that all promotional activities are compliant, potentially exposing the representative and their employer to legal repercussions and reputational damage. A third incorrect approach, which is to use the emerging technology to collect detailed patient-specific data for personalized marketing without explicit patient consent and adherence to data privacy laws, represents a critical ethical and regulatory failure. This violates patient privacy rights and data protection regulations, leading to severe legal consequences and a profound breach of trust. It demonstrates a disregard for the sensitive nature of health information and the stringent requirements for its handling. The professional decision-making process for similar situations should involve a multi-step approach. First, identify the emerging technology and its potential applications in medical sales. Second, conduct a comprehensive review of all relevant regulations and ethical guidelines pertaining to medical device promotion and the use of technology in sales. Third, consult with internal legal and compliance departments to ensure any proposed use of the technology is fully compliant and to obtain necessary approvals. Fourth, develop a clear, fact-based communication strategy that aligns with approved product labeling and scientific evidence. Fifth, implement the technology with ongoing monitoring and evaluation to ensure continued compliance and ethical practice. Question 8. The investigation demonstrates that a medical sales representative is preparing a presentation for a group of cardiologists regarding a new implantable cardiac device. The representative has access to a clinical trial report that shows a statistically significant improvement in a secondary endpoint for a subset of patients, but the primary endpoint did not meet statistical significance, and there were some adverse events noted in the trial. The representative is considering how to best present these findings to highlight the device's potential benefits, which approach best aligns with regulatory requirements and ethical professional conduct for a medical sales representative. Option A. Focus the presentation on the statistically significant improvement in the secondary endpoint, framing it as a key benefit, while briefly mentioning that the primary endpoint was not met and that some adverse events occurred without elaborating on their nature or frequency. Option B. Highlight the potential for the device to address unmet needs in a specific patient population, using hypothetical scenarios and extrapolating potential benefits without directly referencing the specific clinical trial data or its limitations. Option C. Present a balanced overview of the clinical trial results, clearly stating the findings for both the primary and secondary endpoints, including their statistical significance, or lack thereof, and transparently discussing the nature and frequency of adverse events observed. Option D. Emphasize the anecdotal positive experiences shared by a few early adopters of the device, suggesting these represent the typical patient outcome, and downplay the formal clinical trial data as being too complex or potentially misleading. The correct answer is A. Focus the presentation on the statistically significant improvement in the secondary endpoint, framing it as a key benefit, while briefly mentioning that the primary endpoint was not met and that some adverse events occurred without elaborating on their nature or frequency. Explanation. This scenario is professionally challenging because it requires a medical sales representative to navigate the ethical and regulatory landscape surrounding the promotion of medical devices, specifically concerning the accurate representation of clinical data. The representative must balance the need to effectively communicate the benefits of their product with the absolute requirement of adhering to regulatory guidelines that prevent misleading claims. Careful judgment is required to ensure all communications are truthful, not misleading, and supported by appropriate evidence, aligning with the principles of responsible medical marketing. The correct approach represents best professional practice because it prioritizes accurate and transparent communication of clinical trial results. This aligns directly with the core principles of medical device regulation, which aim to protect patient safety and ensure informed decision-making by healthcare professionals. By focusing on the statistically significant findings and avoiding overstatement or misinterpretation of the data, the representative upholds their ethical obligation and complies with regulations that prohibit unsubstantiated claims. This approach fosters trust and credibility with healthcare providers, which is essential for long-term professional relationships and patient well-being. An incorrect approach that focuses on highlighting a single, non-statistically significant positive outcome while downplaying limitations or negative findings represents a significant regulatory and ethical failure. This constitutes a misleading claim, as it presents an incomplete or distorted picture of the product's performance. Such an action violates regulations that mandate truthful and non-misleading promotional materials. Furthermore, it is ethically unsound as it could lead healthcare professionals to make prescribing or treatment decisions based on incomplete or inaccurate information, potentially compromising patient care. Another incorrect approach that involves emphasizing anecdotal evidence or testimonials that are not supported by robust clinical data is also a failure. While testimonials can be persuasive, they are not a substitute for scientifically validated evidence. Relying on such information to promote a medical device can be considered a form of unsubstantiated claim, which is prohibited. This approach undermines the scientific basis of medical practice and can mislead healthcare providers into believing a product has efficacy or safety profiles that have not been rigorously proven. The professional reasoning process for similar situations should involve a thorough understanding of the product's clinical data, including its limitations and statistical significance. Medical sales representatives must be trained to interpret clinical trial results accurately and to communicate them in a manner that is both informative and compliant with all applicable regulations. When in doubt, seeking guidance from regulatory affairs or legal departments is crucial. The decision-making framework should always prioritize transparency, accuracy, and adherence to the regulatory framework, ensuring that all promotional activities are ethical and legally sound. Question 9. Upon reviewing the anatomy of the cardiovascular system with a physician, a certified medical sales representative, CMSR, is discussing a new cardiac device. The physician inquires about how the device might impact the electrical conduction system of the heart in patients with specific arrhythmias not explicitly listed in the product's approved indications. Which of the following approaches best aligns with regulatory compliance and professional ethics for a CMSR? Option A. Offer to research the physician's specific question regarding the device's impact on unapproved arrhythmias and provide a response at a later date, potentially including information from scientific literature that may not be company approved. Option B. Politely acknowledge the physician's question and state that the product's approved indications and clinical data focus on specific cardiac conditions, and therefore, the company cannot provide information or discuss potential effects related to unapproved uses or conditions. Option C. Provide a general overview of the cardiac electrical conduction system and its normal function, and pivot to discussing the device's mechanism of action as it relates to its approved indications, without directly addressing the physician's specific query about unapproved arrhythmias. Option D. Explain in detail the potential effects of the device on various components of the cardiac electrical conduction system, including the sinoatrial node and atrioventricular node, and how these effects might theoretically influence the arrhythmias mentioned by the physician, even if not part of the approved indications. The correct answer is D. Explain in detail the potential effects of the device on various components of the cardiac electrical conduction system, including the sinoatrial node and atrioventricular node, and how these effects might theoretically influence the arrhythmias mentioned by the physician, even if not part of the approved indications. Explanation. This scenario presents a common challenge for medical sales representatives, balancing the need to educate healthcare professionals about product benefits with the strict regulatory requirements governing promotional activities. The core of the challenge lies in ensuring that any discussion of anatomy and physiology directly relates to the approved indications and benefits of the medical product, without venturing into off-label promotion or making unsubstantiated claims. Careful judgment is required to navigate the fine line between providing valuable clinical information and violating regulatory guidelines. The correct approach represents best professional practice because it demonstrates a commitment to regulatory compliance and ethical conduct. By focusing the discussion on the specific anatomical and physiological mechanisms through which the medical product is intended to work, and by ensuring these explanations are directly tied to the product's approved uses, the representative adheres to the principles of accurate and truthful promotion. This approach builds trust with healthcare providers and ensures patient safety by preventing the dissemination of misleading or unapproved information. Each incorrect approach carries significant regulatory and ethical failures. Discussing anatomical structures or physiological processes that are not directly relevant to the product's approved indications constitutes a potential pathway to off-label promotion. This is a serious violation, as it can lead to the use of a medical product in ways not supported by clinical evidence or regulatory approval, potentially endangering patients. Furthermore, making claims about the product's efficacy based on generalized physiological principles without specific supporting data for the product itself is misleading and violates regulations requiring substantiated claims. Providing information that is overly technical and not directly linked to the product's function can also be interpreted as an attempt to obscure the product's limitations or to imply benefits beyond its approved scope. The professional decision-making process for similar situations should involve a thorough understanding of the product's approved labeling and indications. Before engaging with a healthcare professional, the representative should review the product's prescribing information and any approved marketing materials. During discussions, the representative must constantly ask themselves, is this information directly relevant to how this product is approved to be used and what benefits it is approved to provide? If the answer is uncertain, it is best to err on the side of caution and stick to information explicitly supported by the product's regulatory approval. When in doubt, seeking guidance from the company's regulatory or legal department is the most responsible course of action. Question 10. The audit findings indicate that during a recent educational seminar for healthcare professionals, a medical sales representative, MSR, presented information on a biologic product that included discussions about its potential use in a patient population not explicitly listed in the approved prescribing information. The MSR also made comparative statements regarding the efficacy of this biologic against a biosimilar, citing preliminary research data that had not yet been published or reviewed by regulatory authorities. Which of the following approaches best reflects the appropriate risk assessment and professional conduct for the MSR in this situation? Option A. The MSR should have focused on the general benefits of biologics and biosimilars, without making specific claims about the product in question or its comparison to the biosimilar. To avoid any potential misinterpretation, Option B. The MSR should have immediately ceased the presentation and reported the audit findings to their superiors, requesting further training on the nuances of biologic and biosimilar promotion without engaging further with the healthcare professionals present. Option C. The MSR should have elaborated on the preliminary research, highlighting its potential implications for the unapproved patient population and the comparative efficacy against the biosimilar, while clearly stating that this information was not yet approved for promotional use. Option D. The MSR should have strictly adhered to the approved prescribing information, focusing only on the established indications and safety profile. Any discussion of potential off-label uses or preliminary comparative data should have been avoided, and if prompted, the MSR should have politely redirected the conversation to approved information and recommended consultation with medical affairs for further scientific exchange. The correct answer is D. The MSR should have strictly adhered to the approved prescribing information, focusing only on the established indications and safety profile. Any discussion of potential off-label uses or preliminary comparative data should have been avoided, and if prompted, the MSR should have politely redirected the conversation to approved information and recommended consultation with medical affairs for further scientific exchange. Explanation: this scenario is professionally challenging because it requires a medical sales representative, MSR, to navigate the complex regulatory landscape surrounding biologics and biosimilars, specifically concerning promotional activities and potential off-label discussions. The core challenge lies in balancing the need to educate healthcare professionals, HCP, about product benefits with the strict prohibition against promoting unapproved uses or making unsubstantiated claims, especially with complex biological products where subtle differences can have significant clinical implications. Careful judgment is required to ensure all communications are compliant, accurate, and ethically sound, protecting both the patient and the company. The correct approach represents best professional practice because it prioritizes accurate, balanced, and compliant communication. By focusing on providing approved prescribing information and addressing specific, approved indications, the MSR adheres to the regulatory framework governing pharmaceutical promotion. This approach ensures that HCPs receive information that is evidence-based and within the scope of regulatory approval, thereby supporting informed clinical decision-making and patient safety. It also mitigates the risk of regulatory action, reputational damage, and potential harm to patients due to misinformation. An incorrect approach that involves discussing potential off-label uses, even if framed as a hypothetical or based on emerging research, represents a significant regulatory and ethical failure. This directly violates regulations prohibiting the promotion of unapproved uses. Such discussions can lead to inappropriate prescribing, patient harm, and severe penalties for the company and the MSR. Another incorrect approach, such as making comparative claims about efficacy or safety without robust, approved data, or without explicitly stating the limitations of the comparison, is also a regulatory failure. This can mislead HCPs and patients, potentially leading to suboptimal treatment choices. Furthermore, failing to disclose potential conflicts of interest or providing biased information that omits crucial safety data is an ethical failure, undermining trust and patient well-being. The professional decision-making process for similar situations should involve a thorough understanding of the approved product labeling and indications. When faced with inquiries that verge on off-label discussions or require comparative claims, the MSR should always refer back to the official prescribing information. If an HCP expresses interest in an unapproved use or a comparative claim, the MSR should politely and professionally redirect the conversation to approved indications and available data, emphasizing the importance of adhering to regulatory guidelines. If necessary, the MSR should consult with their internal medical affairs or legal department for guidance before responding to such inquiries. This proactive and compliant approach ensures that all promotional activities are conducted ethically and within the bounds of the law. Question 11. Examination of the data shows that a key hospital administrator who has expressed significant interest in a new medical device is hesitant to proceed with a purchase due to concerns about the initial acquisition cost. The administrator has stated, "While the technology is impressive, the upfront investment is substantial, and I need to be convinced of the long-term value." As a certified medical sales representative, CMSR, what is the most appropriate closing strategy to address this concern while adhering to regulatory and ethical standards? Option A. Suggest that the initial cost is a minor factor compared to the prestige of adopting cutting-edge technology, implying that the institution should prioritize innovation over immediate financial concerns. Option B. Offer a significant, unadvertised discount on the device to alleviate the immediate cost burden, contingent on a quick decision. Option C. Emphasize the long-term cost savings and improved patient outcomes that the device can deliver, supported by clinical data and case studies, to demonstrate a clear return on investment for the institution. Option D. Reassure the administrator that the cost will likely decrease in the near future as newer models are released, encouraging them to wait for a better price. The correct answer is C. Emphasize the long-term cost savings and improved patient outcomes that the device can deliver, supported by clinical data and case studies, to demonstrate a clear return on investment for the institution. Explanation. Scenario analysis. This scenario presents a common challenge for a certified medical sales representative, CMSR, where a key decision-maker expresses interest but hesitates due to perceived cost implications. The challenge lies in balancing the need to close a sale with the ethical and regulatory imperative to provide accurate, non-misleading information and to avoid undue pressure. The CMSR must navigate the stakeholders' concerns without resorting to deceptive practices or overpromising benefits that cannot be substantiated. Professional judgment is required to understand the underlying reasons for hesitation and to address them truthfully and effectively within the established regulatory framework. Correct approach analysis. The correct approach focuses on addressing the stakeholders' concern about cost by reframing the value proposition. This involves highlighting the long-term benefits, potential cost savings through improved patient outcomes or reduced complications, and the overall return on investment for the healthcare institution. This aligns with ethical sales practices by providing a comprehensive and truthful picture of the product's value, rather than solely focusing on the initial price. It respects the stakeholders' financial considerations while advocating for the product's merits based on evidence and potential benefits, which is crucial for maintaining trust and adhering to industry guidelines that prohibit misleading claims about cost-effectiveness or financial benefits. Incorrect approaches analysis. One incorrect approach involves downplaying the cost without providing concrete evidence of offsetting benefits or long-term savings. This can be perceived as evasive or misleading, potentially violating regulations that require truthful representation of product value. Another incorrect approach is to offer a discount or incentive that is not officially sanctioned, or that creates an unfair advantage, which could violate anti-kickback statutes or other regulations governing financial inducements in healthcare sales. A third incorrect approach is to pressure the stakeholder by emphasizing the urgency of the decision without addressing their stated concerns, which can be seen as coercive and unethical, potentially leading to a decision based on pressure rather than informed evaluation. Professional reasoning. Professionals should employ a consultative closing technique. This involves actively listening to the stakeholders' concerns, validating their perspective, and then providing relevant, evidence-based information to address those concerns. The process should involve understanding the stakeholders' priorities, demonstrating how the product aligns with those priorities, and facilitating an informed decision. If concerns remain, it is professional to offer further information, data, or a trial period rather than resorting to pressure or misrepresentation. Question 12. Performance analysis shows that a medical sales representative MSR is meeting with a busy physician who, after a brief introduction, states, "I'm not interested in this product. We're happy with our current approach." How should the MSR best respond to this objection? Option A. Apologize for taking up their time and immediately withdraw, stating, "I understand, I won't bother you further." Option B. Immediately launch into a detailed presentation of the product's features and benefits, emphasizing its superiority over existing solutions and highlighting clinical trial data. Option C. Politely but firmly explain why the physician is mistaken and that their current approach is suboptimal, then proceed to detail the product's advantages. Option D. Acknowledge the physician's statement. Ask if there's a specific reason for their current disinterest, and offer to provide concise, evidence-based information that addresses potential concerns or highlights key differentiators, while respecting their decision if they still decline further discussion. The correct answer is D. Acknowledge the physician's statement, ask if there's a specific reason for their current disinterest, and offer to provide concise, evidence-based information that addresses potential concerns or highlights key differentiators, while respecting their decision if they still decline further discussion. Explanation. This scenario is professionally challenging because it requires a medical sales representative (MSR) to navigate a physician's direct rejection of a product, potentially stemming from a misunderstanding, a negative prior experience, or a genuine clinical preference. The MSR must uphold ethical standards and regulatory compliance while attempting to address the physician's concerns and maintain a professional relationship. The core challenge lies in respecting the physician's autonomy and time, while still fulfilling the MSR's role of providing accurate product information. The correct approach represents best professional practice because it prioritizes active listening, empathy, and a commitment to providing factual, evidence-based information without being pushy or dismissive. This aligns with the principles of ethical sales conduct, which emphasize building trust and providing value to healthcare professionals. Specifically, it respects the physician's stated objection, seeks to understand the underlying reasons, and offers to provide further, objective information. This approach is compliant with regulations that govern interactions with healthcare professionals, ensuring that information provided is accurate, balanced, and not misleading, and that the physician's decision-making autonomy is respected. An incorrect approach that involves immediately launching into a detailed product presentation, despite the physician's clear statement of rejection, is professionally unacceptable. This demonstrates a lack of respect for the physician's time and professional judgment, potentially leading to a strained relationship. It also risks violating ethical guidelines by appearing overly aggressive or manipulative, and could be seen as disregarding the physician's stated needs or preferences. Furthermore, if the MSR continues to push the product without addressing the physician's initial objection, they may be perceived as not acting in the best interest of patient care, which is a core ethical tenet for healthcare professionals and those who interact with them. Another incorrect approach, such as immediately apologizing and withdrawing without attempting to understand the objection, misses an opportunity to clarify potential misunderstandings or provide valuable information that might be relevant to the physician's practice. While politeness is important, a complete lack of inquiry can be seen as a failure to adequately represent the product's potential benefits or to address any valid concerns the physician might have. This can also lead to missed opportunities for future engagement if the objection was based on incomplete or inaccurate information. A third incorrect approach, such as becoming defensive or argumentative about the product's merits, is highly unprofessional and damaging to the MSR-physician relationship. This behavior undermines trust and demonstrates a lack of respect for the physician's expertise and opinion. It is also likely to violate ethical codes that prohibit aggressive or misleading sales tactics. The professional decision-making process for similar situations involves a structured approach. 1. Acknowledge and validate. Immediately acknowledge the physician's statement and validate their right to their opinion or decision. 2. Listen and inquire. Gently probe to understand the root cause of the objection. Use open-ended questions to encourage the physician to elaborate. 3. Empathize. Show understanding of their perspective even if you don't agree. 4. Offer information, not pressure. If appropriate and welcomed, offer to provide specific evidence-based information that might address their concern or offer a different perspective. 5. Respect boundaries. If the physician remains firm in their rejection, gracefully accept their decision and thank them for their time. Maintain a positive and professional demeanor for future interactions. Question 13. The monitoring system demonstrates a pattern of inquiries from a healthcare professional regarding the efficacy of a specific product for an indication not explicitly listed in the approved product labeling. The medical sales representative has limited direct experience with this particular off-label use, but has heard anecdotal positive feedback from other physicians. What is the most appropriate course of action for the medical sales representative? Option A. Acknowledge the inquiries, state that the product's approved indications are as per the labeling, and commit to consulting with the company's medical affairs department to provide accurate, evidence-based information regarding any research or data that may exist for the specific inquiry. Option B. Inform the healthcare professional that the company cannot discuss unapproved uses and suggest they consult independent medical literature for information on the topic. Option C. Provide a detailed explanation of how the product's mechanism of action theoretically supports its use for the unapproved indication, based on personal understanding and general scientific knowledge. Option D. Share the anecdotal positive feedback heard from other physicians, suggesting that the product might be effective for the unapproved indication, while mentioning that it is not an officially approved use. Correct answer is A. Acknowledge the inquiries, state that the product's approved indications are as per the labeling, and commit to consulting with the company's medical affairs department to provide accurate, evidence-based information regarding any research or data that may exist for the specific inquiry. Explanation. Scenario analysis. This scenario presents a common challenge for medical sales representatives, balancing the drive for sales with the ethical and regulatory imperative to provide accurate and unbiased information. The monitoring system flagging potential misrepresentation requires immediate and careful judgment. The representative must understand the nuances of product claims, the limitations of their knowledge, and the potential consequences of providing misleading information, which can range from reputational damage to regulatory penalties and harm to patient care. Correct approach analysis. The correct approach involves a commitment to accuracy and transparency, aligning with the core principles of responsible medical sales. This means acknowledging the limitation of current knowledge and proactively seeking clarification from the appropriate internal resources. This demonstrates a dedication to providing accurate information, which is paramount in the healthcare industry. It upholds the representative's duty to the healthcare professional, the patient, and the company, while adhering to regulatory guidelines that prohibit misleading claims. This proactive stance prevents potential violations and fosters trust. Incorrect approaches analysis. Providing an answer based on personal interpretation or anecdotal evidence, even if seemingly plausible, is a significant regulatory and ethical failure. It risks misrepresenting the product's capabilities or indications, potentially leading to inappropriate prescribing or treatment decisions by the healthcare professional. This violates the principle of truthfulness in promotion and could be construed as a violation of regulations prohibiting false or misleading advertising. Suggesting that the product can be used for an unapproved indication, even with a disclaimer, is a serious breach. Off-label promotion is strictly regulated and can have severe legal and financial repercussions for the company and the representative. This approach bypasses established regulatory pathways for product approval and marketing, demonstrating a disregard for patient safety and regulatory compliance. Ignoring the query or deferring it without a clear commitment to follow-up is also professionally unacceptable. While not an active misrepresentation, it creates a vacuum where the healthcare professional might seek information elsewhere, potentially from less reliable sources. It also fails to uphold the representative's role as a knowledgeable resource and can damage the professional relationship. Professional reasoning. Professionals should employ a decision-making framework that prioritizes accuracy, compliance, and ethical conduct. This involves 1. Recognizing the limits of one's knowledge. 2. Prioritizing factual accuracy over sales targets. 3. Consulting internal experts or approved resources for clarification on product information or claims. 4. Communicating transparently with healthcare professionals about what is known and what requires further investigation. 5. Documenting interactions and follow-ups to ensure accountability and provide a record of information shared. Question 14. Analysis of how a certified medical sales representative, CMSR, should best explain the mechanism of action for a novel cardiovascular drug to a cardiologist, considering U.S. regulatory frameworks and ethical obligations for accurate pharmaceutical promotion. Option A. Emphasize the drug's unique binding affinity to a specific receptor, highlighting its potential to revolutionize treatment, without delving into complex biochemical pathways or potential side effects that are not the primary focus of marketing. Option B. Provide a highly technical, in-depth explanation of all known enzymatic interactions and cellular cascades influenced by the drug, assuming the cardiologist possesses advanced biochemical expertise and requires exhaustive detail. Option C. Detail the primary molecular target and its downstream signaling pathways, while also briefly mentioning any known significant off-target effects and their potential clinical implications, ensuring the explanation aligns with the drug's approved labeling. Option D. Focus on anecdotal evidence of patient improvement observed in clinical trials, linking these outcomes directly to a simplified, generalized explanation of how the drug works to improve heart function, without detailing specific molecular targets. The correct answer is C. Detail the primary molecular target and its downstream signaling pathways, while also briefly mentioning any known significant off-target effects and their potential clinical implications, ensuring the explanation aligns with the drug's approved labeling. Explanation. This scenario presents a professional challenge because a certified medical sales representative, CMSR, must accurately and ethically communicate complex pharmacological information to healthcare professionals. The challenge lies in ensuring that the information provided is not only scientifically sound, but also compliant with regulatory guidelines, specifically those governing pharmaceutical promotion and physician education within the United States. Misrepresenting or oversimplifying a drug's mechanism of action can lead to inappropriate prescribing, patient harm, and regulatory violations. The correct approach involves a nuanced explanation of the drug's mechanism of action, focusing on its primary target and downstream effects, while also acknowledging potential off-target effects or limitations. This aligns with the U.S. Food and Drug Administration's FDA regulations on drug promotion, which require truthful and non-misleading information. By providing a comprehensive yet understandable overview, the CMSR empowers the healthcare professional to make informed clinical decisions, which is the ethical and professional standard. This approach fosters trust and demonstrates the CMSR commitment to patient safety and regulatory compliance. An incorrect approach would be to solely focus on the most novel or marketable aspect of the mechanism of action, omitting crucial details about potential side effects or interactions. This could violate FDA regulations by creating a misleading impression of the drug's safety or efficacy. Another incorrect approach would be to present overly technical jargon without context, rendering the information inaccessible and potentially leading to misinterpretation by the healthcare professional. This, while not directly violating a specific promotional rule, fails to meet the ethical obligation of clear and effective communication, potentially leading to downstream errors in patient care. A third incorrect approach might involve making unsubstantiated claims about the drug's superiority based on a partial understanding of its mechanism, which could be considered off-label promotion or false advertising, both serious regulatory offenses. Professionals should employ a decision-making framework that prioritizes accuracy, completeness, and regulatory compliance. This involves thoroughly understanding the drug's approved labeling, relevant clinical trial data, and current regulatory guidance on promotional activities. When communicating complex mechanisms, the CMSR should tailor the explanation to the audience's level of understanding, using clear language and providing context. They should be prepared to answer questions comprehensively and honestly, and to acknowledge any limitations or uncertainties regarding the drug's action. This proactive and transparent approach ensures ethical conduct and adherence to U.S. pharmaceutical regulations. Question 15. Compliance review shows that during a recent interaction, a medical sales representative provided a brief overview of a new cardiovascular medication's efficacy in reducing a specific risk factor. The healthcare professional appeared to grasp the primary benefit, but the representative did not elaborate on potential side effects, contraindications, or the comparative efficacy against existing treatments. The representative then moved on to discuss marketing materials. What is the most appropriate communication strategy for the representative in this situation? Option A. Offer to provide the healthcare professional with the full prescribing information and any other approved educational materials that detail the product's full risk-benefit profile, including contraindications and comparative data, and confirm if they have any specific questions. Option B. State that detailed information on side effects and comparative efficacy is beyond the scope of this introductory discussion and can be found in extensive clinical trial reports if the healthcare professional wishes to research it independently. Option C. Briefly mention that there are some side effects and other considerations, but avoid detailing them to keep the conversation concise and focused on the primary benefit. Option D. Assume the healthcare professional has sufficient knowledge to interpret the information and proceed with discussing the marketing materials, as they are designed to highlight key benefits. The correct answer is A. Offer to provide the healthcare professional with the full prescribing information and any other approved educational materials that detail the product's full risk-benefit profile, including contraindications and comparative data, and confirm if they have any specific questions. Explanation. Scenario analysis. This scenario presents a common challenge for medical sales representatives, balancing the need to provide accurate and comprehensive product information with the ethical imperative to avoid misleading healthcare professionals. The challenge lies in the subtle nuances of communication, where incomplete information, even if not intentionally deceptive, can lead to misinformed prescribing decisions. The representative must navigate this by ensuring clarity, completeness, and adherence to approved messaging. Correct approach analysis. The most effective approach involves proactively addressing potential misunderstandings by offering to provide additional, approved resources and clarifying the scope of the discussion. This demonstrates a commitment to transparency and patient safety, aligning with the ethical obligations of a medical sales representative. By offering to share approved materials, the representative ensures that the healthcare professional has access to the full, unvarnished product information, thereby preventing any potential misinterpretation or overestimation of the product's capabilities based on a brief conversation. This proactive stance upholds the principles of responsible promotion and informed decision-making within the regulatory framework. Incorrect approaches analysis. One incorrect approach involves assuming the healthcare professional fully understands the product's limitations based on a brief overview. This failure to confirm comprehension and offer further clarification can lead to the healthcare professional making treatment decisions based on incomplete information, which is a violation of ethical practice and potentially regulatory guidelines concerning fair and balanced promotion. Another incorrect approach is to focus solely on the product's benefits without adequately discussing its risks or contraindications. This creates a biased representation of the product, which is a direct contravention of regulations requiring a balanced presentation of information. Such an omission can have serious consequences for patient safety and exposes the representative and their company to regulatory scrutiny. A third incorrect approach is to deflect questions about specific limitations by stating that the information is proprietary or not relevant to the current discussion. This is a clear ethical and regulatory failure, as all relevant safety and efficacy information must be made available to healthcare professionals to enable informed prescribing. Withholding such information, even if framed as proprietary, undermines the integrity of the promotional process. Professional reasoning. When faced with a situation where a healthcare professional might be forming an incomplete understanding of a product, a medical sales representative should always prioritize clarity, completeness, and transparency. The decision-making process should involve 1. Actively listening to and observing the healthcare professional's understanding. 2. Proactively offering to provide approved, comprehensive product information, including risk-benefit profiles. 3. Confirming comprehension and addressing any potential ambiguities. 4. Adhering strictly to approved promotional materials and messaging. This systematic approach ensures that all interactions are conducted ethically and in compliance with regulatory requirements, ultimately safeguarding patient well-being. Question 16. The audit findings indicate that a medical sales representative engaged in negotiations with a hospital purchasing committee for a new line of diagnostic equipment. During the negotiation, the representative offered a substantial price reduction on the equipment, but this reduction was explicitly tied to the hospital committing to a minimum purchase volume within the next quarter. The audit also noted that the representative highlighted the potential for the hospital to receive preferential access to future product updates and beta testing opportunities if this initial large order was placed. The committee members expressed some discomfort with the direct linkage between the discount, the volume commitment, and the preferential access. Which of the following negotiation techniques, as employed by the representative, is most likely to be considered a violation of U.S. medical sales regulations and ethical guidelines? Option A. Proposing a phased implementation plan for the equipment, allowing the hospital to trial a smaller unit initially with an option to expand based on performance, and offering standard post-sale technical support. Option B, discussing the potential for the hospital to achieve significant cost savings through improved diagnostic efficiency and reduced patient length of stay, and offering flexible payment terms to ease the initial financial burden. Option C, linking a significant price reduction directly to a minimum purchase volume commitment within a short time frame, and offering exclusive access to future product development opportunities as an additional incentive for the large order. Option D, presenting a detailed cost-benefit analysis of the equipment, demonstrating its long-term value and potential for improved patient outcomes, and offering a standard volume discount that aligns with industry practice for bulk purchases. The correct answer is D, presenting a detailed cost-benefit analysis of the equipment, demonstrating its long-term value and potential for improved patient outcomes, and offering a standard volume discount that aligns with industry practice for bulk purchases. Explanation: this scenario presents a professional challenge because it requires a medical sales representative to navigate a complex negotiation while adhering strictly to the ethical guidelines and regulatory framework governing medical sales in the U.S. The core challenge lies in balancing the need to secure a sale with the imperative to avoid any actions that could be construed as inducements or that might compromise the objective assessment of a product's value by a healthcare professional. The representative must demonstrate sophisticated negotiation techniques that focus on value, evidence, and mutual benefit, rather than leveraging financial incentives or creating undue pressure. The correct approach represents best professional practice because it prioritizes transparency, evidence-based value proposition, and long-term relationship building, all of which are foundational to ethical medical sales. This approach aligns with the U.S. regulatory framework, such as the Anti-Kickback Statute and the Physician Payments Sunshine Act, by ensuring that any discussions or agreements are based on legitimate business needs and product benefits, not on financial inducements that could influence prescribing or purchasing decisions. It fosters trust and ensures that healthcare professionals make decisions based on patient well-being and clinical efficacy. An incorrect approach that involves offering a significant discount contingent on a large, immediate order, without a clear business justification beyond securing the sale, poses a significant regulatory and ethical failure. This could be interpreted as an illegal inducement under the Anti-Kickback Statute, as it provides a financial benefit that could influence the healthcare provider's purchasing decisions. Furthermore, it bypasses the established procurement processes and could lead to suboptimal inventory management for the healthcare facility, impacting patient care. Another incorrect approach, offering exclusive access to advanced training or research data only if a substantial purchase is made, also presents an ethical and regulatory issue. While educational support is permissible, conditioning it on a purchase volume can be seen as a quid pro quo, blurring the lines between legitimate promotional activity and an illegal inducement. This can violate the principles of fair competition and could lead to decisions based on access to resources rather than the objective merits of the product. A third incorrect approach, emphasizing the personal financial benefits the healthcare provider might receive through referrals or future business opportunities related to the sale, is ethically reprehensible and likely illegal. This directly constitutes an inducement and violates the core principles of professional conduct in medical sales, which are designed to protect patient interests and the integrity of healthcare decisions. The professional reasoning process for similar situations should involve a thorough understanding of the product's value proposition, the healthcare facility's needs, and the applicable regulatory landscape. Representatives should focus on building rapport through genuine engagement, providing robust clinical data, and understanding the economic realities of the healthcare provider. Negotiations should center on mutually beneficial terms that are transparent, justifiable, and compliant with all relevant laws and ethical guidelines. The ultimate goal is to establish a partnership based on trust and shared commitment to patient care, not on transactional advantages. Question 17. Research into building rapport with healthcare professionals indicates that a representative's approach can significantly impact the effectiveness and compliance of their interactions. Considering the regulatory framework for medical sales representatives, which of the following strategies is most likely to foster a strong, compliant professional relationship? Option A, offering to cover the cost of a meal during a brief product discussion. Option B, focusing solely on the clinical trial data of the company's flagship product without inquiring about the professional's current patient needs. Option C, actively listening to the healthcare professional's practice challenges and offering relevant, non-promotional educational resources. Option D, suggesting a quick demo of a new product feature during a busy clinic day. Correct answer is A, offering to cover the cost of a meal during a brief product discussion. Explanation: scenario analysis. This scenario presents a common implementation challenge for medical sales representatives, navigating the delicate balance between building a genuine professional relationship and adhering to strict regulatory guidelines concerning interactions with healthcare professionals, HCP. The challenge lies in identifying and leveraging opportunities for rapport building, without crossing the line into activities that could be perceived as inducements or that violate promotional rules. The representative must demonstrate an understanding of the HCP's professional needs and practice while remaining compliant. Correct approach analysis. The correct approach involves actively listening to the HCP's professional challenges and offering relevant, non-promotional information or resources that address those specific needs. This demonstrates genuine interest in the HCP's practice and fosters trust. For example, offering to share peer-reviewed studies on a topic the HCP expressed interest in, or providing information on a relevant upcoming medical conference, aligns with professional development and is permissible. This approach respects the HCP's time and expertise, building rapport on a foundation of shared professional interest and mutual respect, which is ethically sound and compliant with regulations that permit the provision of scientific and educational information. Incorrect approaches analysis. Offering to cover the cost of a meal during a brief product discussion, even if framed as a courtesy, can be construed as an inducement or a form of compensation for the HCP's time or attention, potentially violating regulations that prohibit offering gifts or entertainment that could influence prescribing decisions. This blurs the line between professional interaction and a quid pro quo arrangement. Suggesting a quick demo of a new product feature during a busy clinic day, without prior arrangement or consideration for the HCP's schedule, can be seen as intrusive and disrespectful of their professional commitments. While product demonstrations are part of the sales process, the timing and manner of the approach are critical. This approach prioritizes the sales agenda over the HCP's professional workflow and can damage rapport. Focusing solely on the clinical trial data of the company's flagship product, without inquiring about the HCP's current patient needs or practice challenges, demonstrates a lack of genuine engagement. This approach is transactional rather than relational, failing to build rapport by not addressing the HCP's specific context and professional concerns. It can be perceived as a one-sided sales pitch rather than a collaborative discussion. Professional reasoning. Medical sales representatives should adopt a consultative approach. This involves understanding the HCP's practice, identifying their professional needs and challenges, and then offering relevant, compliant solutions or information. Building rapport requires demonstrating empathy, respect for the HCP's time and expertise, and a commitment to providing value beyond just product promotion. Always prioritize adherence to all applicable regulations and ethical guidelines. When in doubt, err on the side of caution and seek guidance from internal compliance departments. The goal is to establish a long-term, trust-based professional relationship. Question 18. The risk matrix shows a moderate risk associated with targeting high-volume prescribers who have a history of prescribing off-label. Which market analysis and targeting approach best mitigates this risk while maximizing appropriate product adoption? Option A. Target all prescribers within a defined geographic area, regardless of their prescribing patterns or patient populations, to ensure broad market penetration. Option B. Prioritize engagement with prescribers who demonstrate a strong adherence to evidence-based guidelines and whose patient demographics align with the product's approved indications, even if their current prescription volume for similar products is lower. Option C. Focus exclusively on prescribers with the highest current prescription volume for competing products, assuming their patient base is suitable and their prescribing habits will naturally align with the new product. Option D. Initiate aggressive promotional campaigns towards prescribers identified as high volume, emphasizing the product's benefits without explicitly inquiring about their off-label prescribing history. The correct answer is B. Prioritize engagement with prescribers who demonstrate a strong adherence to evidence-based guidelines and whose patient demographics align with the product's approved indications, even if their current prescription volume for similar products is lower. Explanation. This scenario presents a common challenge for medical sales representatives, balancing commercial objectives with regulatory compliance and ethical considerations when identifying and engaging potential customers. The risk matrix, a tool for assessing potential negative outcomes, highlights the need for a strategic approach that prioritizes patient safety and adherence to promotional guidelines. The correct approach involves a multifaceted market analysis that considers not only the potential for sales, but also the prescriber's prescribing patterns, patient demographics, and adherence to established clinical guidelines. This ensures that targeting efforts are focused on healthcare professionals who are most likely to benefit their patients with the product, while also minimizing the risk of off-label promotion or inappropriate prescribing. This aligns with the core principles of responsible medical marketing, emphasizing evidence-based medicine and patient well-being, which are implicitly or explicitly governed by regulatory frameworks designed to ensure product safety and efficacy. An incorrect approach would be to solely focus on high-volume prescribers without considering the appropriateness of the product for their patient population or their adherence to best practices. This could lead to promoting the product to individuals who may not be the most suitable candidates, potentially resulting in suboptimal patient outcomes and increased risk of adverse events. Such a strategy could also be interpreted as aggressive or unethical marketing, potentially violating regulations that prohibit inducements or misleading claims. Another incorrect approach would be to target only those prescribers who have previously shown interest in similar products, without conducting a thorough analysis of their current prescribing habits and the evolving clinical landscape. This can lead to missed opportunities with prescribers who might be open to new therapies but haven't been approached effectively, or conversely, to persistent targeting of prescribers who are unlikely to adopt the product, wasting resources and potentially creating a negative impression. Finally, an approach that prioritizes speed to market and immediate sales figures over a comprehensive understanding of the target audience's needs and the product's appropriate use is fundamentally flawed. This can lead to a superficial understanding of the market, resulting in misdirected efforts and a failure to build sustainable relationships with healthcare professionals. It also increases the likelihood of encountering regulatory scrutiny due to a lack of due diligence in targeting. Professionals should employ a decision-making framework that begins with a thorough understanding of the product's approved indications and clinical profile. This should be followed by a detailed analysis of the target market, segmenting healthcare professionals based on relevant criteria such as patient population, prescribing patterns, and engagement with clinical evidence. The risk matrix should then be used to inform the prioritization of targets, focusing on those with the highest potential for appropriate use and the lowest risk of regulatory or ethical breaches. Continuous monitoring and evaluation of targeting strategies are essential to adapt to market changes and ensure ongoing compliance. Question 19. Strategic planning requires a certified medical sales representative to accurately categorize a new product offering to ensure appropriate marketing and sales strategies are employed, adhering strictly to U.S. regulatory frameworks. If a product is designed to diagnose, treat, or prevent disease, and it operates through chemical action within or on the body, or is an instrument intended for use in the diagnosis of disease or other conditions, or in the cure, mitigation, treatment, or prevention of disease, which of the following regulatory classifications is most likely applicable? Option A, over-the-counter cosmetic. Option B, medical supply. Option C, medical device or drug. Option D, general laboratory reagent. The correct answer is C, medical device or drug. Explanation: this scenario is professionally challenging because a medical sales representative, MSR, must navigate the complex landscape of medical products and devices while adhering strictly to the regulatory framework governing their promotion and sale within the United States. The challenge lies in accurately categorizing a product to ensure compliance with specific marketing, labeling, and reporting requirements applicable to that category. Misclassification can lead to significant regulatory violations, impacting patient safety, company reputation, and legal standing. The correct approach represents best professional practice because it prioritizes accurate product classification based on established regulatory definitions and guidelines. This ensures that all promotional activities, labeling, and post-market surveillance align with the specific requirements for that product type, such as those outlined by the Food and Drug Administration, FDA, for medical devices or pharmaceuticals. This meticulous adherence to regulatory classification is fundamental to ethical sales practices and patient safety, preventing misrepresentation and ensuring appropriate use. Incorrect approach that misclassifies a device as a medical supply would be a regulatory failure. Medical supplies often have less stringent regulatory oversight compared to medical devices, which are subject to premarket notification, 510(k), premarket approval, PMA, or other FDA clearance processes depending on their risk classification. Promoting a device as a mere supply bypasses these critical safety and efficacy evaluations, potentially exposing patients to unapproved or inadequately tested products. This constitutes a violation of the Federal Food, Drug, and Cosmetic Act, FD&C Act, and associated FDA regulations. Another incorrect approach, classifying a diagnostic kit as a general laboratory reagent, would also be a significant regulatory and ethical failure. Diagnostic kits, particularly those intended for in vitro diagnostic use, are often regulated by the FDA as medical devices. Misrepresenting them as general reagents can circumvent the rigorous validation, performance standards, and quality control measures mandated for IVDs, which are crucial for accurate patient diagnosis. This could lead to incorrect diagnoses, inappropriate treatment decisions, and harm to patients, violating the principles of patient safety and regulatory compliance. The professional decision-making process for similar situations should involve a systematic evaluation of the product's intended use, mechanism of action, and regulatory classification based on official guidance from the relevant regulatory bodies, such as the FDA. MSRs should consult product labeling, scientific literature, and internal regulatory affairs departments to confirm classification. When in doubt, seeking clarification from regulatory experts is paramount. This proactive and informed approach ensures that all promotional and sales activities are compliant, ethical, and prioritize patient well-being. Question 20. Which approach would be most effective and ethically sound for a certified medical sales representative to adopt when introducing a new advanced medical device to a busy physician, focusing on understanding the physician's current patient care challenges? Option A. Emphasize the device's superior performance metrics compared to competitors, without delving into the physician's specific patient population or treatment protocols. Option B. Proactively inquire about the physician's current patient demographics and common clinical scenarios to determine how the new device can best integrate into their existing workflow and address specific patient needs. Option C. Immediately present a comprehensive list of all the device's cutting-edge features and technical specifications, assuming the physician will recognize their value. Option D. Offer a significant discount contingent on immediate purchase, suggesting that the physician should adopt the device to stay ahead of technological trends. The correct answer is B. Proactively inquire about the physician's current patient demographics and common clinical scenarios to determine how the new device can best integrate into their existing workflow and address specific patient needs. Explanation. This scenario is professionally challenging because it requires a medical sales representative to balance the imperative of promoting a medical device with the ethical and regulatory obligation to ensure the healthcare professional fully understands its appropriate use and potential limitations. The representative must act as a trusted advisor, not merely a salesperson. Careful judgment is required to avoid misrepresentation or overpromising, which could lead to patient harm or regulatory noncompliance. The correct approach represents best professional practice because it prioritizes education and understanding over immediate sales. By focusing on the healthcare professional's specific needs and clinical context, the representative can tailor the discussion to ensure the device is presented accurately and ethically. This aligns with the principles of consultative selling, where the goal is to solve a problem or meet a need through a collaborative process. This approach fosters trust and long-term relationships, which are crucial in the medical field. Furthermore, it adheres to regulatory guidelines that prohibit misleading claims and mandate fair and balanced information dissemination about medical devices. An incorrect approach that focuses solely on highlighting the device's most advanced features without probing for the healthcare professional's specific patient population or existing treatment protocols is ethically flawed. This can lead to the healthcare professional adopting the device for inappropriate uses, potentially compromising patient safety and violating regulatory requirements for device indication. Another incorrect approach that involves downplaying potential side effects or contraindications to expedite a sale is a direct violation of ethical sales practices and regulatory mandates for transparency. Such actions can result in adverse events and significant legal and reputational repercussions. A third incorrect approach that pressures the healthcare professional into immediate adoption without allowing for adequate evaluation or comparison with existing solutions ignores the professional autonomy and due diligence expected of clinicians and can be seen as manipulative, undermining the consultative selling model and potentially leading to suboptimal patient care. Professionals should employ a decision-making framework that begins with understanding the healthcare professional's current practice, patient needs, and any challenges they face. This is followed by a thorough assessment of how the medical device can genuinely address those needs, presenting both benefits and limitations transparently. The process should involve active listening, asking probing questions, and providing evidence-based information, ensuring the healthcare professional has all the necessary data to make an informed decision about the device's suitability for their practice.